Hello, this is Always, ALLWAYS for the Academy for Lifelong Learning at Cape Cod Community College on beautiful Cape Cod, Massachusetts. I'm Joan Friedman, and the purpose of Always is to introduce the Academy of Lifelong Learning to a broad audience. Our ALL mission is to help keep our over 50 population informed, involved, both intellectually and socially. We have a new curriculum that is posted on our site and our Facebook page twice a year, along with our current events. Along with spreading the news about our courses, we want to introduce you, our audience, to our course coordinators. All of our course coordinators are volunteers, so we need to give them a very big thank you. But we also want to showcase their diverse backgrounds and very strong skills in areas that they have been teaching for many years or areas that they have always wanted to teach in. ALL is very lucky to have many new coordinators this semester, and I'd like to introduce you to one of them now. Today we have Dr. Robert Santulli, Honorary Associate Professor of Psychiatry at the Geisel School of Medicine at Dartmouth College. He's a visiting scholar in the Department of Psychological and Brain Science at Dartmouth College in Hanover, New Hampshire. Dr. Santulli was the Director of Geriatric Psychiatry and the Memory Clinic at Dartmouth-Hitchcock Medical Center and the Geisel School of Medicine at Dartmouth College, and is the past president of the Alzheimer's Association of Vermont and New Hampshire. Dr. Santulli has been teaching the course Alzheimer's Disease and Other Dementias at the Academy of Lifelong Learning this semester. Dr. Santulli, we are so appreciative and so thankful to have you with us. Could you please tell us a little bit about yourself and about your background?
Sure, I'll be glad to. Well, as you indicated in the introduction, I'm a geriatric psychiatrist and had worked for many years at Dartmouth-Hitchcock Medical Center and Dartmouth College, Dartmouth Medical School up in New Hampshire. And my specialty over these years has been geriatrics, and within that, the field of dementia. And I've gotten more and more focused. I became more and more focused on dementia as the years went by. I stopped seeing patients a few years ago, retired from practice essentially, but continued to teach both undergraduates as well as in other settings, including lifelong learning settings such as ALL, but in New Hampshire, OSHA in New Hampshire and so forth. So that's what I've done. I've been very interested in this field for quite some time, and the more I explore it, the more interesting it gets and the more exciting it is in many ways. And I certainly know that this population and the people who ALL serves and programs like ALL serve, those over 50, are especially concerned about their cognitive status and about people they know or care about who may or may not have dementia. And so I'm happy to be able to provide what I hope is useful information to them about dealing with this.
Again, the Academy of Lifelong Learning is so appreciative of your time and your knowledge and your great skills. I know that you just finished teaching your class today.
Today.
Could you tell me a little bit about your class? How did that go? What did your class look like? We hope that you liked teaching it.
I enjoyed it very much. I think we had, I'm not sure what the final number was, 15 to 18 people in the class who were very attentive and interested and very enjoyable to get to know. The class, I did use a PowerPoint presentation in each session, but tried to be as open as possible to as much discussion during the class and afterwards, or during the presentation and during the breaks between different subjects. So it was both a series of presentations as well as a discussion. And as I found in teaching over the years in many settings, as the class goes on, it becomes a bit like a small community, and people get to know each other, and you get to know them, and it feels more, very comfortable, and people start sharing more about themselves and their own interests and concerns as time goes on. So that's very gratifying. And as I say, it was quite enjoyable to teach. There's always, 6 sessions where the sessions are an hour and 20 minutes, is nowhere near enough time to cover as broad a subject as Alzheimer's and dementia. But I think it's a good start, and I tried to hit the important things and provide people with lots of options for reading if they wanted to go further into the subject. So that's essentially what the class looked like. I think it went well, but we'll see what the students say.
Well, I'm absolutely sure that it went well, and there does, as you said, become more and more of an interest in this area. A lot of us have had parents and loved ones who have suffered through dementia and other brain illnesses, but also for a younger population to start looking for signs and symptoms and what they could do to probably avoid any of those brain illnesses. Could you talk to us a little bit about the signs and the symptoms about Alzheimer's?
Well, the most common feature, and the one that everyone thinks of first, is memory impairment, short-term memory impairment, meaning people often begin early in the disease with having no trouble remembering what happened many, many years ago, but having difficulty remembering more recent events, things that happened in the last days or weeks or hours or minutes even. So that's one of the most common signs. Other signs that happen that concern people are difficulties with activity. People with early signs of Alzheimer's can become very apathetic. Some appear depressed, but may just be apathetic, losing interest in things. They may have trouble with their language, having difficulty thinking of words to use, and we all have that as we get older, thinking of names and so forth, but it's a matter of degree. And that points out that there really are no hard and fast distinctions between the kind of memory issues that all of us over past middle age begin to experience. I say all of us, almost all of us. There are probably some people who don't, the lucky ones, I'm not one of them, who, may have less sharp memories than they once did, or less able to do 2 things at once than they once were able to. But that's common and normal, concerning and annoying at times, but normal. And when that becomes worse to a certain degree, then we begin to get concerned, and people need to have a formal medical assessment.
Yeah. Okay. And people would need to get a diagnosis. Are there particular steps that people should take to get their diagnoses, or evaluations that are common and out there?
Well, I think the first thing I always recommend to people is that they talk to their primary care doctor about what their concerns are, and that often means, and sometimes this can be more complicated because of privacy laws, but that not only the person who has memory concerns, but perhaps their spouse or their closest family member needs to be a part of that discussion, who may be noticing things or seeing things or remembering things that the individual, him or herself, isn't. So it's an important first step to go for that evaluation. Talk to the physician. He or she may do some preliminary testing, some evaluation, look over certain their medications. Some medications can cause some fogginess in thinking. Look over their general health and medical status, and may order some other additional tests, and or may simply refer them to a specialist, a neurologist typically, who deals with this sort of thing. So, as I say, the first thing that I encourage people to do is when they have concerns that are, beyond, oh gosh, I can't remember what that person's name is, but things that are really beginning to interfere with your functioning in some way or other, to talk to the family doctor about it, the primary care physician, and take it from there. Let that person ask the right questions, make an evaluation, and possibly make a referral.
When we talk about Alzheimer's and sort of end-of-life diseases, we always talk about the primary caretaker, which you've mentioned, becomes an area of equal concern. If anybody is going through that right now, if anybody's in that role of primary caretaker to an Alzheimer's patient or to anybody that's failing, do you have any advice for them?
You're right that's a very, very important consideration in and how the primary caregiver is doing is perhaps the most important single factor in how well somebody who has memory problems will do. So making sure that primary caregiver is getting the help that they need, is learning what they need to know about cognitive disorders, is able to talk to people about it through a support group or through going to a center where these things are dealt with. Those are very important because many caregivers, particularly spousal caregivers, feel, oh, I can handle this. It's my job. I'm supposed to do it. But it's too big a job for any one person, and people need help, need to talk to others, need assistance, need a break every now and then. And so paying attention to those, to how that caregiver is doing, is all important in caring for somebody with dementia.
I believe that you're the first person that I have ever heard say that the primary caregiver and their needs are every bit as important as the person who is failing in whatever area, and certainly something that as a community, the medical community, the mental health community, really needs to take a look at, so that the spouse, the daughter, the friend does not feel that they're in that alone. I think that's a huge part of spreading the word about
Absolutely.
this. But what inspired you? You told us a little bit about it, but what inspired you to teach the course here at the Academy for Lifelong Learning?
Well, as I mentioned, we lived for many years, for over 30 years, in central New Hampshire, Hanover, New Hampshire, and just moved down to the Cape, or down to this area. We don't live on the Cape, actually. We live in Plymouth, but just moved down here fairly recently. And I had previously taught at Dartmouth. There is a branch of OSHER, which is in the lifelong learning community, and I taught courses there, done that both live and over Zoom. And I taught undergraduates at Dartmouth, and I enjoy teaching. And I've known, it certainly is clear that this, as I said, this area, even among people who are well educated and bright, are lacking often in the information they need to have in order to deal with something like a cognitive disorder, like Alzheimer's or another dementia. So, and I felt that was so important that I wanted to be able to share that. And as I said, again, in realizing that in places like the Cape, which has lots of older individuals, and in programs like ALL, where the focus is on people over 50, that there's a great deal of interest and concern about this, and I wanted to be able to address that. So when we moved down to this area, I began to think about where I might, after sort of getting settled in for a while, think about where I might be able to do some of the things that I was doing in New Hampshire. Had some friends that we'd met here who had taken courses at ALL and spoke very highly of it, and So looked into it and wanted to get involved, and contacted them, and that's how I got started with it last spring, I guess that was. So that's how. And again, it's enjoyable for me to teach. I like teaching for whatever reason, but I think especially I like it because I know that people need it, and I can offer something that people need, and that feels good.
Like I said, we're so lucky to have you here,
Well, I'm glad to do it.
and that you would share your skill with us. But something that I think that the Cape is taking a look at, if not, all of the United States of America, is that our largest population, our boomer population, is our biggest population, and we're living longer than we ever did.
Yes, well, that's absolutely true.
That we don't talk about retirement now. We talk about early retirement and mid-retirement, and really, really end of life. So there's all these stages that people are working through, and the diseases that come along with them. So that having you, with your background, down here on Cape Cod, helping all of us navigate this time in our life that's really new. I mean, new to us.
New to us, yeah.
And new to mankind, because we weren't living this.
That's right.
Living this long. So,
That's right.
so this is a dynamic field. This is something that we are, that we're learning about, learning as we go.
Yes, it's wonderful that we're all living longer, but it does bring along an increase in the risk of getting some of these old age diseases like dementia.
Is it learning how to fly the plane while you're flying the plane? If somebody was thinking about joining the Academy of Lifelong Learning, or specifically if somebody else, like yourself, is thinking about teaching, or what can I add to the community, what advice would you give them?
I would strongly encourage them to pursue it. If someone has an interest in a particular field, whether it be something from their profession or, somebody who did something totally different but has always had an interest in, let's say, European history or whatever it is, they should pursue that. One of the things that I often say is that when I teach, I get as much out of it or more than my students do. And teaching is one of the best ways to learn about a subject. I know much more about Alzheimer's and dementia now that I'm teaching it because I got to stay current. And as a field, any scientific field like that, medical field, it's constantly changing. And there are new developments all the time, new medications that have just come out in the last months or so that one needs to stay on top of. So I think keeping active, keeping your mind going, keeping that spirit of inquiry alive is very enjoyable and very important for all of us to do. It's good. It's a good way to help lessen your chance of getting dementia, by the way. So if somebody asked me about doing it, I would strongly encourage them to go ahead with it and try it out and see if you enjoy it.
We, as our ALL community, are always encouraging people to please, jump in and join us. Taking a class or 2 or 3. That, as you said, they can be either 6 weeks or they can be a 12-week course. Your class, I know, was an in-class class.
Yes.
Okay, but for people who aren't comfortable with that or live outside of the area, maybe somebody, on the islands, or somebody who's from the Cape but vacationing, we do have our Zoom classes. Pretty much about 50-50 are in class and Zoom, because that's what our population seems to be demanding. Some people want that social contact, and some people like the convenience of Zooming.
Yes.
We also have hybrid capability with our D10 and so that we can have mixed classes now. So to anybody that would be interested in teaching, we have a number of modalities to teach with and to teach through, and we're always looking for new coordinators. In any of the areas that Dr. Santulli has mentioned: history, art, music, self-care. The list it goes on and on. We do have two catalogs that go out twice a year that we're very proud of. We're very proud of the content, and then we are sincerely proud of the coordinators who volunteer their time for us. So, Dr. Santulli, is there anything else that you wanted to mention about yourself, your class, your experiences at ALL? Anything else that you wanted to tell us? Or?
No, I think we've covered. You've asked a lot of good questions about it, and it's. I think I've been very. Of course, I didn't know anything about ALL. I didn't know anything about the Cape before we moved down here, but I've been very impressed by what I've seen and the quality of programming and the people there and the facilities, and I think it's a terrific asset for the Cape to have this, and I'm glad that people do take advantage of it. And I think the option that mostly came about thanks to COVID with Zoom and other ways of reaching people that weren't face to face. I think it's wonderful that exists, and people who are thinking about becoming coordinators should think about how they might want to do it and what would work best for them, as well as for the population that they're trying to reach.
Put very, very well. That we're still trying to come back after COVID. We're it's the new normal. It's it's the new world out there. Trying to find out how people want to learn. As I said, whether it's coming in and being with people a few hours a day because they're either retired or they're working from home and want to be with people a couple hours a day, or if people are still comfortable with staying in their own home and having some stimulating conversation over their devices, seems to be going both ways right now. So we're trying to hit all of those nails on all of those heads. But Dr. Santulli, I want to thank you for your time.
My pleasure.
I know you've had a busy day. You've been teaching, and I know that you've got a long ride home, so I'm appreciative of your time and your effort.
Glad to do it.
As always, I want to thank the staff here at Cape Cod Media Center in Dennisport for all of their training and their support, which I could not do without. We watch us on our Mid Cape station, which is channel 26, on Mondays at 11 a.m. or Thursdays at 6 p.m. The show is Always, and it showcases our instructors. Instruct some of their courses. We also have our poetry slam on there that's broadcast. So a number of different modalities. Our podcasts are on there. This is our first. This is called a podcast, but it's a podcast with a video component. This is our first video podcast. So please turn in on channel 26 on Mondays at 11 or Thursdays at 6. Always can also be found on our ALL site, which is capecodall.org. We also have a Facebook page at the Academy for Lifelong Learning on Cape Cod. Please like us there for our updates and our course offerings and our social events. Once you like us, you'll get all of our information right to your devices. We can also be found on YouTube. Our YouTube page is under the Academy for Lifelong Learning Presents Always. I would like again to thank my special guest, Dr. Robert Santulli, and all of you who've gifted us with your time. This is Joan Friedman. Thank you and goodbye.